It's been a year since the world changed. The COVID-19 pandemic altered every aspect of our lives. Social distancing, wearing masks, remote work, and remote learning became part of our regular vocabulary. The world as we knew it changed, isolated from family and friends, loved ones, canceled vacations and weddings. Life events such as birthdays, proms, graduations, and other celebrations went virtual or became drive-by celebrations. COVID disrupted our lives and the world longed to return to normal. The vaccine held a promise of all of us returning to our way of life. Since the new administration took office, there's been an increase in production and distribution of the vaccine. The coronavirus ravaged Black communities. According to Mayo Clinic, Black Americans contracted COVID at rates almost 5 times that of their white counterparts. Despite that statistic, vaccine hesitancy in our communities were fueled by fears of the vaccine, the government's history with medical experiments on Black Americans, and an overall mistrust of the government and the healthcare system. Adding to this hesitancy are issues concerning vaccine equity and plenty of false information. We've heard from health officials and experts, but we wanted to talk to everyday people who have received the vaccine. What were their experiences? Were there side effects? What were their thoughts before and after getting the vaccine? The Chicago Defender is pleased to welcome you to our COVID vaccine roundtable, where you'll hear from everyday people who obtained the vaccine from different locations and at different times. Listen to what they have to say. Hello, this is Danielle Sanders, managing editor at the Chicago Defender, and I am here today speaking with Chicagoans who have taken the vaccine, and we're going to talk about their experiences with the vaccine and why it's important for those in the Black community to get vaccinated to help all of us achieve herd immunity, so we can actually get back to a certain sense of normalcy, whatever that looks like in the future. So one of the things I wanted to discuss first is some of the myths that are surrounded the vaccine. Many of us have seen things on social media and online, but the reality is that COVID and this disease, this virus has affected the Black community at a rate 3 to 4 times greater than other communities. And at this point, even though the CDC has said that Black people are coming around to getting the vaccine right now, we're at about 50% of people who are saying that they're willing to get it. I wanted to talk about some of these things. Myth number one that I've heard is that the vaccine can affect a woman's fertility. There are rumors and discussions online that if you take the COVID vaccine, particularly if you're a woman, you'll have difficulty conceiving, you'll suffer miscarriages for those that are pregnant. And the reality is that is not true. There are no confirmed reports of miscarriages or fertility issues that have happened with women who have received the vaccine. And that is according to Johns Hopkins University and the Mayo Clinic. That the vaccine encourages the body to create copies of the protein found on the coronavirus surface, which is what teaches your body's immune system to fight the virus that gets it. So that's what you're taking when you're getting vaccinated. So there is no proof that the vaccine affects a woman's fertility or is dangerous for women who are pregnant. So right now, pregnant women can get the vaccine, and women who anticipate being pregnant can get the vaccine. So that's myth number one. Myth number two, if you've already had COVID, you don't need the vaccine. I don't know, some of you have heard that. I already had COVID. My body has the antibodies. I don't need to get it. That is another myth that also is not true. Even though you have the antibodies from the COVID vaccine, you can still catch coronavirus again if you're not vaccinated. And because they're severe, for those of us in the Black community, primarily who have pre-existing conditions, asthma, diabetes, high blood pressure, those are all risk factors that will increase the likelihood of you being hospitalized in the event you do get COVID. So that's another myth, according to Mayo Clinic and Johns Hopkins, that is not true. So, third myth, and I know everybody's heard this one. The government rushed this vaccine. And because they rushed it and moved so fast, none of the protocols were followed. So I don't trust it. I don't think it's safe. Has anybody heard those same myths?
Yes.
Yes.
Mhm.
That is another myth that is not true. The reality is our government has been working on a vaccine for a virus such as this for quite a while. Before the previous administration, during the Obama administration, they started research and work um, regarding this vaccine. And unlike the Tuskegee experiment, Black people have been involved in the production, the research, and the development of this vaccine from the very beginning. Specifically, most of most people are familiar with Dr. Kizzy Corbett, who is a young Black, extremely gifted woman and scientist who has been working with Dr. Fauci for the longest on the development of this vaccine. So we have our people in the room who are helping to develop and produce this vaccine. And even though it was given an emergency production, that does not mean that all the safety protocols and safety checks that need to go through with every other vaccine were not followed. They actually were. This just enabled the government to get this vaccine to the people quickly, quicker than normal. But it's actually something that's been researched and studied for quite a while. So that is one of the major differences when we talk about comparing previous medical experiments on Black people versus what this actual vaccine is and what it isn't. So those are the main ones that I've had. Have you guys, and I want you guys please to introduce yourself, tell me your name, age or age range, and what you do for a living, and let me know what things have you heard people say about the vaccine.
I'll go first. My name is Angie T. And I work for the city of Chicago in my 30th year. I also sit on the board of Roseland Hospital, the new Roseland Hospital. One myth that you didn't talk about was, and I heard from a grown adult, and I really thought she was joking, but when I heard other people say it, they said that the vaccination was a chip.
Oh yeah.
Oh yeah.
They tracking you.
They were
tracking you.
injecting us with. I received my vaccination in December the 18th to be exact. I knew a bunch of my friends that just was, and let me say this, Danny, I also had reservations probably when the VP was saying, if Dr. Fauci get it, I'm getting it. So I had reservations, but I will say probably out of everybody on here, I probably was the first one. It was designed that way because I wanted them to see. I researched. It was based on Dr. Kizzy being at the table. It was based on learning about this mRNA. It was not a rushed vaccine. It was not a DNA vaccine. Actually, the mRNA, the messenger comes out of your system once it goes, it targets that protein spike and takes it to, your T cells or whatever cells. So let me just say, I wanted to get it. And I'm staff of a hospital who just so happened, I came in from Florida and I tested myself 4 days later for COVID. I came back negative and the vaccination came in. And they were like, look, I was like, what are all those sirens and lights that came in with police escort? They were like, that's the vaccine. And the city said that staff can get it first. So I was considered staff. my results came in that night. The very next day, which was a Friday, I came back and I got vaccinated. And I went Facebook Live because I wanted everybody to know that I'm regular. They see me all the time on Facebook and at parties. So I just wanted them to know that I was okay. And then I came back in my second dose January the 8th, and I let everybody know. And I'm really glad that a lot of people saw that I was okay and they were willing to take the vaccine.
Now, Shanae, you're also an essential worker as well. What was your experience getting the vaccine?
Well, my name is Shanae. I'm a 48-year-old registered nurse. I've been traveling on the front line with an emergency COVID response team. It's been a year. April 3rd made a year. And initially, I was kind of hesitant too. I did have COVID, survived COVID, had the antibodies. However, because there is no true research that states that because I am antibody positive that I can't catch COVID again. Because as we know, with any virus, it mutates.
Mm-hmm.
So even though my body may recognize the strand of COVID that we have now, there could be another strand that comes out and it does not recognize it.
Mm-hmm.
So I wanted to do my due diligence. I can't persecute people who aren't wearing masks, who aren't practice social distancing, if I'm not doing my due diligence to do everything I can to protect myself as well as my family and my patients.
Mm-hmm.
So while in Arizona, I had the opportunity to get the vaccine,
Mm-hmm.
And so it's hard for me because I've seen the worst of the worst with COVID. So if all it takes is for me to get a vaccination, and any virus is a live virus. However, this is not a live virus being put into you. And that's what frustrates me is that people don't realize exactly what the vaccine is.
Mm-hmm.
I was fortunate enough to get Moderna. And I say fortunate enough is because I bought stock in Moderna. So I was like, hey, I'm paying into what I'm already doing. So the first shot, my arm, I wanted to just like take it off and get it back after it didn't hurt anymore. That was my only side effect. The second one, I was just tired, but I didn't have any of the COVID symptoms.
Mm-hmm.
And I think if you've ever had COVID, you would take the chance and get that vaccine because that vaccine effects were nothing like having COVID. But yeah, I will say that because this is a roundtable discussion about us as a Black people, is that I've come in contact with people pretty much in the last 6 states, Hispanic, Asian, Black, white. We are the biggest people who are population who are negative as far as the benefits, that the risk factors and the stereotypes outweigh the benefit. And that's the frustrating part for me. So I definitely was elated, ecstatic, excited when Angie did start the Facebook group. I got vaccinated. And it was good to see people who are prominent, be it on the so-called Chicago scene, house scene, whatever. To see all of us get it, I just hope that that really kind of encourages others.
Mm-hmm.
So I thank you for allowing me the opportunity to be on this roundtable discussion because I see it every day. And that's what we need to realize.
Absolutely.
I'd rather do something than nothing.
My name is Lisa. I'm 55 years old. I work in the education field. I work with autistic children. I received my shot through my church, which is Salem Baptist Church of Chicago. And I received Pfizer.
Mm-hmm.
My issue was that I was afraid. I was really scared. I didn't know what the outcome would be. So I was like, okay, if my principal can take it and she'll be all right, if my coworkers can take it and they'll be all right, I will be okay.
Mm-hmm.
So it was kind of hard for me to get the test because every time I tried to sign up for it, there was no appointments. So I just got really fortunate with my church and I took it. I'm fully vaccinated, of course. And my experience was that my pain went from this arm to this arm. It was really crazy. Yeah. And I had chills and I was tired for the first one. For the second one, I still had chills. I had chills again and I was tired. But other than that, it went really well. So now that I've gotten it, my friends are getting it. So I think that once you see how well it goes, because I did watch you, Angie T, and I was like, oh, she okay too. And then
Hey,
hers, and I'm like, okay, maybe I can do this. So I
Mhm.
think it's just the fear for us. You know, as a people, we just really don't like a lot of change going on, you know. And this is really big for, you know, it's a big change. It's a big adjustment for us.
Well, I think it's interesting because with both vaccines, everyone talks about Dr. Kizzy with Moderna, but there's a Nigerian doctor, a black man from the Yale School of Medicine who has been on the team for Pfizer. But like I said, when it comes to these vaccines, on no matter which one you take, black people have been in the room, black scientists, black doctors,
Mhm.
black, I don't know the correct term, immunologist, I don't know the correct term, but they've been in the room helping to do all of the research, which is what gave me comfort, when it came to the choice of whether or not, because like most, I was very much, especially with the previous administration, I I, I just didn't trust it. But I definitely, once we got back to listening to scientists and things of another nature, then I felt a little bit more comfortable. Did any of you guys experience, and I want to talk to some of the ones I haven't spoken to yet, was there a fear initially that you kind of overcame in getting the vaccine?
so for me, it was not a fear.
Who are you?
I'm a Don- well, I am Donovan Robinson. I am 49 and holding to 50 till July 26th. As you all can see, I've been on a world tour, celebrate my fly at 50. But for me, and my background is I'm all over the place. Yes, I'm a director of students for restorative practices for Chicago Public School High School. Yes, I own a casket business of 20 years, so I hear about death every day. Yes, I do not call myself a promoter. I call myself a marketing influencer. And also, yes, I'm a future politician. So I'm all over the place with a whole lot of things. But for me, it was not a fear factor. It's because I like to get on planes. I like to go. And so I had the attitude of is that if this is going to help me be able to live my life the way I like to live it,
I like
it's
that.
because
Good.
as many of you all know, my hashtag is no dress rehearsal to this life. And I say that all the time on social media. It's because of being in the death industry, you see and hear about death all the time. I saw many families that loved ones who died of COVID. I just had a family member that I was putting a casket together, color scheme, and she said, "Hold on, hold off. My uncle died of COVID." So we may do cremation. And so I've heard the many people that was going through it, especially for my dear friend right here, Shanae, when she was sick. She was going through it. She was deep in the hospital, and I saw what she was going through. But what really pushed me to really jump out there and do it is because of Angie T.
Amen.
She said, when I do it, I had to promote it. It's because I have a voice in the community.
Mhm.
And that will encourage others to go out there and do it. Yes, we heard all the stories that you were going to grow a tail, your arm was going to fall off, there was a chip, you was going to walk with a limp. I heard all of those things. But for me, working in the school, I said, well, when we were kids, we had to get shots to go to school. That was just mandatory.
Yeah.
To get a job with the city of Chicago, I had to get a shot, TB shot. That was just one of the requirements. So we know that this COVID shot is going to be a requirement. So I said, you know what, let me get out ahead of this thing and be that forerunner for our community to show them that it's okay.
Mhm.
Yes, after the first shot, I was fine. The second shot, got down to Northwestern Hospital, Laurie Children's Hospital, got upstairs, took the shot. I'm like, I'm straight. I went over to Tavern on Rush to get me something to eat for breakfast, had 2 glasses of champagne, got home and threw all that stuff up. Had
Mhm.
chills, fever, everything. But by the time I woke up 6 hours later, yes, as you always saying, was I at the family then? Yeah, because it was a Sunday. So I had work to do. So everybody's everybody body is different.
Mhm.
And so we as a community still have to promote it to say this is what we need to do. When you look at the numbers that are going up, it's interesting that they don't talk much about it, but the numbers are going up on the other side of the river.
They
And
sure
that's
are.
the other side of the Chicago River. That's where the numbers are going up at, is because they really never shut down. That's a different world up there. They were still partying in bars and things of that nature. It just never hit the news.
Mhm.
And so this is a community that is refusing to really move forward with getting the shot. Now it's a shame that our community is still behind the eight ball of number wise in comparison to the white community. And that
Mhm.
means is that we still have to push, us getting the information out there. As I was explaining to my principal at Michelle Clark High School, he knows Unity Day is coming up. He said, "What are you going to do?" I said, "Yeah, we'll have the parade, but I just don't want the whole musical event. Can we get the shot again at the school for
Mhm.
that day to give out to people?" It's
Yeah.
because today when I drove past Loretta Hospital, since they're back up and running, giving out the shot, everybody that was in line did not look like us.
Mhm.
And they're right there on the west side of Chicago in the Austin community getting this shot. And I don't think that's right.
Do any of you guys, because I definitely picked up on that. I'm on the south side, and that Walmart, the new health clinic that opened up when the vaccines opened up, I had never seen so many white people on 83rd at that Walmart. Matter of
Wow.
fact, I don't think I ever have. So
Wow.
there is this conversation about equity and having access to the vaccine. But if we're not going to take it, guess who's coming from the north side in Indiana?
Exactly.
So
Mhm.
what was your experience with getting your appointments? Did you guys, I know some of you guys got it through work, but for those, what was your experience getting the appointment initially?
So I can say for me, my name is Kelly Thomas again. I apologize for being late. Initially, it, like some people have described on Facebook, it felt like the Hunger Games, like for real. It really did. Initially, I was very apprehensive, but because I have an 89-year-old father, I wanted to make sure that he was protected and that also I was protected, and I did everything that I could and did to make sure he got the vaccine too. So I made sure he got his vaccine first, but it took multiple attempts going online and checking my text messages diligently every time. Sometimes I would get a text message at like 4 o'clock in the morning. I'm like, okay, let me check my phone. And literally trying to get in and schedule an appointment. I just stayed at it. I stayed at it. And I was able to finally schedule an appointment for him. It took maybe about another week or two to schedule an appointment for myself. But I was just committed. Once I made up my mind that this is what I was going to do, that it was going to happen. I didn't stress over it, but I just said, if it's meant to be, it'll be. And thankfully, it did work out.
Signed up on ZocDoc, and I got a text when they opened up vaccines and made an appointment. So I do know initially there was this mad rush to get the vaccines. Did any of you guys go through ZocDoc? What avenues did you go through to get your vaccine appointments?
This is Gary Heflin, and I'm a consultant to the food and beverage industry. I own a catering business. And I mean, this is Chicago. So, I mean, you are always one person away from getting whatever you want done. And I was one of the very first people in Chicago to get it done. And, the things out there wasn't a lot of fear on my part because, I mean, God already gave me 55 of them. Man, if I ended today, I've lived more in a week than probably most people are living their life. So, I mean, it wasn't a lot of fear. It wasn't a lot of apprehension. The advice that I give everybody, and I mean, if you're in a group, you see me and I'll tell you that, hey, if you've had the vaccination, go ahead and make sure that you stay hydrated because it really helped me. I mean, I had no problems behind it. The first vaccination that I got, and I mean, like I said, I was one of the very first people in Illinois to get vaccinated. The first shot that I got, I did push-ups after that. The second one I worked out. And I haven't had any problems behind it. It was very easy for me to get on, and it was very easy for me to get a shot. And I mean, the motivating factor for me was that my parents are older and I'm around them quite a bit. So, you know, I definitely want to give myself every opportunity to be successful. As people that have been vaccinated, we also need to be mindful, because it's become a very elitist thing. And we'll ask somebody, well, when are you getting your shot? Instead of saying, what are your thoughts? Because that is where it needs to start with conversation. If a person tells you, you know, I'm not going to do it, then you can approach it differently. And you're not going to convert everybody else. You are not Jesus or in the Bible or any of that stuff. So, you know, if you get 1 for 20, you're doing great. But we do have to be mindful of that. We do have to make it to where it's not elitist, where it's not, I'm smarter than you are and you're dumb. You know, hey, you made a choice. But I think that it's incumbent upon us, those that do have it, to share our stories in those ways that make it easier for other people to do it, but also to be respectful of people's choices not to do it.
Mm-hmm.
Yeah, with me, I just like health. I got it through knowing people, and I got it back in early February. I think when I was able to get in February, I just did it. I was scared. I'm not gonna lie. You know, if anybody's, I was scared because the unknown about everything. So, but I took it because I figure it'd be better for my family. It'd be better for people that I come in contact with. I'll be doing my part to help us all get back to normal. And so I made that leap of faith, and you know, through both shots, I didn't get sick not one time. I thought I was gonna get really sick from it because the flu vaccine makes me sick.
Mm-hmm.
But so I was really scared because I was like, I'm gonna get sick, but I don't care. I'm gonna get this done and over with. But I made it through. And
let me just teach you something real quick, Danielle.
Uh-huh.
The flu virus is a live virus to help you build the antibodies. That's why you get sick.
Yeah.
Okay.
So if you get it again, you're going to get sick again. It's okay.
Okay. I'm glad that I did.
How many of you got the Pfizer and how many got Moderna? Who got Pfizer out of this group?
I got Pfizer.
Yeah,
Pfizer.
Anybody get Moderna?
Woo-hoo. Me and my tax dollars, my stock dollars, Shanae got Moderna.
Linda got to unmute herself.
There
I
we
got
go.
Moderna.
I got Moderna. Okay.
So 3 of us.
I gotta ask you, one of the things when my parents got vaccinated, I just remember feeling this overwhelming sense of relief.
Mm-hmm.
You know, that there's like, I felt like they're safe. How did you guys feel after getting the vaccine? Was there a sense of relief? Was it a nervousness? What did you guys feel immediately after getting that vaccine emotionally?
For me, I'll share. My name is Maureen Archie. I'm 52 years old. I got the Pfizer the 23rd of February, and then the second one was the 16th of March. I did so. My husband is a commercial airline pilot. I am a commercial real estate broker. So I initially felt like my mother did not want to get it and had not gotten it even when I did. So I was hoping to encourage her by getting it myself. I had some adverse reactions. It's the regular symptoms that they said you would get. I did get some. After the first shot, my arm was hurting, not that big of a deal, but then I got exposure to someone who was COVID positive when I traveled out of the States, and came back sick as a dog. I was so sick. It was ridiculous. But I did not test positive for COVID. I had a COVID test and it came back negative. I talked to my doctor about it, and she really felt encouraged that the vaccine was working, and the symptoms that I was feeling, it was a normal process for someone who had been vaccinated, and that basically it was working because the test came back negative, and I just had these mild symptoms. For the most part, they were mild. I had a fever. I had some GI challenges, and after the second shot, and that was only for about 3 days, I would say, after the first shot. And I think had I not traveled, I probably would have been okay. But because I was fine up until coming back from that trip. After the second shot, my arm was hurting. I was fine that day, but somebody else talked about feeling sick like hours later. after they ate. I was so hungry, famished. I went on appointments and showings, but then later that evening, I think I had some ribs, and it didn't go well. I woke up the next day, headache. I had a fever for 3 days, major fatigue, and was basically in the bed for 2 days. Day 3, I was able to work and function again. After that, I was completely fine. So that was my experience. So the fear was more about my mom getting vaccinated. I wanted to have this experience so I could tell her it'll be okay. But she was a little leery after that, but was fine when she saw that I was okay. So she is now fully vaccinated. So I'm excited about that.
My name is Robert Walker. I had the Pfizer, 51 years of age, entrepreneur, business owner. We own a daycare center, so around children, did it more of a protection. My mom, I haven't seen her in a year because she's scared. She just stayed scared of COVID. And actually, she was the one who kind of got the appointment for me. I don't know how she did it, but next thing she doesn't know, I want to see my son. It's been all this time, so she got the appointment. He's like, hey, you got to go here on this day. That was it. And it was more of a protection because we have a daycare and there's nothing but kids, and the kids and everybody, they're the ones who's carrying it. And then I know my mom, she just had the fear of the COVID. So, I just wanted to do it for protection for everything, for myself. I want to see my mother. She ain't going to see me anyway, unless I have it. So now that's really it. The first shot, nothing. It kind of a little sore. Second one, after 4 or 5 hours, I got really fatigued. I was fatigued and hungry. I didn't get that combination, but that was really it. Wasn't scared at all. I mean, everybody has all of these kind of myths, and the Tuskegee project or whatever. The Tuskegee project was one project for one culture. This is for everybody around the world. So they're gonna kind of figure that out. They're gonna get that right because this is for everybody. And I'm gonna be honest, I felt great having it now because for the simple fact that everybody are not doing their fair share. They're not social distance. They're not doing everything, whatever. So like I said, for me, it was more of a protection for myself, for my own family and everything that. So, I'm glad I did it. Went on Facebook. A lot of people was like, couldn't believe that you did it, whatever. And we're doing this. Everybody needs it because some people are sitting on the fence. If they see certain people just doing it, that might kind of leads them to it. And that's it. This is what it all is. And like she said, you got to get it for certain jobs. It's going to be, this is, if you want to go outside, you better have it. Let me put it that way.
Linda Red, 56 years old. I had the Moderna, both vaccines. I'm good. My arm was a little sore. I did get sick from the second one. I had a little fever and chills. So I stayed in the bed all day. I took a couple of Tylenol, went to sleep. Had a couple of shots. The other shot. Oops. Went to sleep and woke up the next day and I was fine. And my son had the Pfizer. He had his first shot almost 2 weeks ago. He didn't get sick. He's doing fine.
It was good to see so many people getting the vaccine. I don't know what they thought, but I was so relieved. I couldn't even explain it. It made me more cognizant of wearing my mask because I just knew that I could still be a carrier and give it to someone unvaccinated. Maybe if I get vaccinated, I won't get as sick. Because it's 100% effective in getting not seriously sick. That means a lot.
It does. That's the difference between you and a hospital bed. What do you guys want? What's the one thing you want people to know who may be on the fence, who may have questions. What's the one thing you would want to tell people about your experience with getting the vaccine?
Get it.
It's a start with open and honest dialogue. I mean, I think that there's a lot of shaming that goes on. I think that, people don't, their information sources are not necessarily the best. Theysaid.com is not a viable news source. And I mean, we know that most people don't do their own research. So, I mean, the way that it's going to happen is through us being ambassadors for it and taking that story out there, but making sure that people want to hear it, because you're never going to convince somebody that truly doesn't want to do something to do it. It's just not going to happen for you like that. So I think that it really starts with conversation. It starts with people, being, and I mean, they're bombarded with imagery from, that confirms the things that they already believe. So it takes people like us to step out and say, hey, you know what? This is true, or this is not true, or this is what you can look forward to. And these are the things. And I mean, Puffy telling you to do it. Yeah, that works if it's vodka, but, not so much if it's for your health.
That's a quote.
I like that.
Want people to know
Kind of funny, Gary. Gary, kind of funny.
I'm a funny guy.
I just want people to, honor the responsibility that we have to one another from a human perspective. We got picked to live during this time. We didn't choose to be here right now. And we can make a choice either way, to get the vaccine, not to get the vaccine. It's so much bigger than us as individuals when we are sharing space with so many other humans. So that's what I mean when I say I hope that people take on more of a how we're connected in this humanity to take care of each other. It's a simple thing that we can do to make sure that we are tapped into how we're all connected. What our responsibility is to the other, our fellow man.
I completely agree.
Introduce myself. I'm Michelle Marsh. I'm from National Black Wall Street, Chicago. I'm basically the special projects coordinator and a trustee for the organization. Once you were able to obtain an appointment online, I was signing up with anybody and everybody I can see. And whichever person called me back first, that's where I was going. And I went to the United Center, and it was so organized. You were in and out in less than 15 minutes. And that made me feel good too, because everything was in order. It wasn't chaos. Like you see on TV, everything was like all over the place. Nobody knew what they were doing. So basically now I have had my second shot. And so far, the only thing is, my arm hurt. Then I accidentally hit it against the door. So that made it hurt even worse. But I'm still okay. I'm around so many seniors in my family that I'm responsible for. So I had to do the responsible thing for myself, because I'm going to be in and out, getting their groceries, going to the store, taking them to the doctor, doing whatever they have to do. So I have to make sure that I was covered. And that's why I took the shots. Because if you're going to be taking care of your elders or anyone, you've got to be able to say that you did your best part to protect them and protecting yourself.
Right. Thank you so much, Danny.
Thank you, Danny.
It was,
I think forums like this, where we're just talking to other people just like us, whether it's in our communities, whether it's on social media, at our churches, and just sharing our experience with getting vaccinated and how you feel and how what the process was like, is going to help get us to that point where we can begin to open up. That is my hope. I miss summer. I miss summertime shot. I miss seeing my friends. I miss hanging out. I miss traveling. I miss traveling. So all of those things were motivators for me to get vaccinated. So I want to thank all of you for joining me. I want to thank you guys. I do intend to keep these roundtables around different issues not just vaccination, but different issues concerning our community. And I think it's important to bring in actual people from our community, not always experts and activists and advocates. Sometimes it's just good to talk to people who are just like you. Thank you guys so much for joining me.